For the next exercise, what we will be doing is reconstituting a dry powder. We have an example, either the Valotech or an antibiotic is a good example. So that will be reconstituted with sterile water. Sterile water can come in this format, or it can also come in an ampule format. We will be attaching the syringe, depending upon the format that we're using, to the needle to the syringe, and leaving the product in the syringe for now. We'll be doing two different techniques. One I will be explaining will be the vented technique, and the other the non-vented technique. So now I'll just transfer this to the hood. So this hood is a little bit crowded because I'm going to be showing two techniques. Normally we like to have a bit more spacing in between these products, but for the sake of explanation. So we take the tops off. You notice I'm collecting my tops in my hands just to prevent any excess movement in the hood. And then with the alcohol swab, we'll clean them. I believe that you can clean more than one vial with the alcohol swab, but the area still has to remain wet. So for this vial here, I will be doing the vented technique. So for the venting, the first thing that you will do is insert into the vial a venting needle. And in this case vial, you will notice that on the very bottom there is a split. So I'll just, with the venting needle, we just open it up and insert it into the top of the rubber, off to the side. The next thing that I'm going to be doing is taking the liquid from the vials and reconstituting. When I set down the syringe, it could go this way or this way. I prefer this way. Again, it's important to make sure you work towards the middle of the hood. Now, I will be taking 10 cc's of air, so of fluid. I will put the appropriate amount of air into the syringe. This can be, if you have done this before, you can actually insert the needle in this angle, but for the lab it would be safer to hold it down and then put the needle in. This is the most comfortable, I believe, way of holding it, and the first air is exposed. So we pull back so that some liquid gets into the syringe, and then push, and then we continue pulling and pushing, making sure that my right hand is not holding the plunger too much, just at the very tip. In this case, the antibiotic vial says to reconstitute with 20 mils. So from the first vial, I've taken as much liquid. And then, again, we have to make sure we have enough air in the syringe. Bevel up in the middle, insert the needle. And you'll notice that there is liquid and air, and we still pull back and push. And because it's a horizontal hood, we can actually go straight up and down. And we pull out 20 cc's and separate. And then now I will just inject the fluid into the antibiotic. The top has already been cleaned. and then we just slowly push it in. The vial can be shaken a small amount. So this is, I will leave this now. This is the, I will reshield the needle, the vented technique, and we will come back to it shortly while I prepare the non-vented, because this is not quite finished. So in this case here, I will do the same part at the beginning, attaching the needle and syringe. Here you'll notice that we don't do anything to the antibiotic at this point in time. So now I will take out the liquid from the bottle. And we pull and push. And it's okay if we get air in there. Separating it, sometimes you can poke yourself, so it's important to make sure that you hold the syringe properly, and you could pull it apart this way. And then I will do the next one. Bevel up, into the middle, push and straighten. And you may cc's. Now, at this point in time, I'll continue with the non-vented while that one is sitting. So I will put the needle into the vial. And you'll notice here when you push the liquid in, because there is no venting, air will want to come back into the syringe to equilibrate. So you have to push it in very slowly, doing a seesaw so that the liquid goes in and the air comes back into the syringe. So one of the advantages, if you're doing multiple bottles, for instance in the vented one, you can do more than one at the same time, or this way you must keep the syringe attached to the vial. And so I'm just shaking the vial so that the powder will dissolve. And so once all of the liquid is in, then the amount of air that's in the syringe should be the same amount. It should be balanced. And so then we will just seesaw, pull back the liquid and push so that what is left is all the liquid is back into the syringe. If there is still some liquid, some solid particles, such as this inside the vial, you can actually push it back in, keeping everything intact and minimizing movement, and then just continue the process. So the entire syringe, the contents will be clear once it's all dissolved. So this is the non-vented. That will just put by the side. Now we can go back and take a look at the one that was vented. With this procedure, we don't need the venting, so we'll draw that out. And we will take air in the syringe, depending upon the volume. And now, because there are more than one hole in the vial, we'll have to be careful. We push it in, and it's important to pull back, and then push. And then we'll fill this up. And because of the therapy, it's important that the entire contents of the vial gets taken out if it was reconstituted with the proper volume. And then we just separate. This is another way, putting it down and pulling it apart this way. And then we have our product inside the syringe.